Hello. Um, Good morning, good afternoon, or good night, or wherever you are listening from. I want to look at something today that baffled me, and I needed to discuss that. So, I operated on a lady. Of course, we have the issue of confidentiality, not sharing any specifics, but this is based on experience, and because it has happened several times. So I'm just asking the question. So this lady had uterine fibroids and I operated on her. She was very happy, and after that, she wanted me to celebrate with her because she's now symptom free. But something remarkable happened. I said, okay, I was trying to go through the internet to see whether there are ladies that actually share their experiences about how they were suffering from all the symptoms of uterine fibroid. They later got surgery, and now their menses is actually normal. They don't have heavy flows anymore. They don't have to stain their underpants and so on. So, why are people not talking about it? He said, okay, well, we are going to discuss it, but I don't want my face to show. I say, so what is the problem? So I started asking questions. It happened once, twice, thrice, four, five, six, seven. It's still the same outcome. So does it mean that people don't want to be associated with uterine fibroids, or they have fibroids and it got operated upon? I know in the days of HIV virus, people don't actually want to own up that they have HIV, and even till date, there's some element of I just want confidentiality. But I never knew this is actually the case of uterine fibroids. So the point is this: if that is the case, what could be the problem? Now, the issue is that there is a lot of patients that have uterine fibroids that are so scared. They are so scared of having surgeries done because they have had several times that when they perform surgery, because they have uterine fibroids, they might not be able to have kids anymore. In fact, on one occasion, they said they might even die because they have uterine fibroids operation, and these patients will now continue to be in this scourge for over the years. I want to tell us today that these are lies. I don't know which part of the internet that actually describes this, that scares women from coming to the hospital to check out if they have uterine fibroid that are symptomatic. So you should know that having uterine fibroid is not the case. It's about having symptoms. So sometimes patient can have uterine fibroid but there are no symptoms. Sometimes patient can have uterine fibroid that are giving a lot of bleeding symptoms and so on. And at this point, you definitely need to, seek for help. So what I'm making this video essentially is this: that time has come when, if you had uterine fibroid and you had surgery and you are doing very well, your women are waiting for you to tell them that I actually did this surgery and I've done well. And I think that the problem is because uterine fibroid is actually a disease of Africans, that maybe we are waiting for other people to do this for us. This is our own. We should start boning up and telling people our experiences so that people can come up, with how to deal with it. I know that there are still research ongoing about trying to know how exactly, to prevent uterine fibroids, that have not been brokered. It's still being researched. People will want to know, and this is all work in progress. Are there things we can do to prevent uterine fibroid? Little research have talked about the issue of diet, the issue of meat and all that, and using vegetables, but these are not, they did not actually hold water, whether these things actually have anything to do in terms of reducing symptoms or even occurrences. People are also scared that they can actually have a recurrence. Yes, there's a possibility, about depending on the school of thought you're looking at, that said about 3 to 27% of cases can actually have a recurrence after you try fibroids. There are risk factors to this. One of them is being an African woman. If you're an African woman, the risk of recurrence is there. If you are between the ages of 30 to 40 years, the risk of recurrence is there. The nature of the fibroid that you have can also increase the risk of recurrence. Or if your fibroid number is more than 3, the risk of recurrence is there. So that is, you now see that most women may have possibility of recurrence. But the truth of the matter is that it is 3 to 27. So why won't you fall in the group that it will not recur? So first of all is that give this a shot. Stop living in denial. One thing you must sure is that if you wake up in the morning and you are not happy about waking up because you have uterine fibroid, because it's giving you symptoms, definitely your quality of life has reduced remarkably. And we are all supposed to be happy. We're supposed to live our life in our fullest, so that we don't wake up in the morning and because of uterine fibroids we are just sad. You comment why women are shying away from talking about this. I want to know more, so that we know how we are going to talk about this and encourage women during our clinics to come on and encourage others. Thank you so much, and I am very happy that you're listening. You can share with friends this so that we can save Africa all together. Cheers.